Hi everyone, my name is Lisa Clarkson. I'm a physical therapist, a functional medicine practitioner, and a movement educator. I'm also the owner of Dancing Tree Physical Therapy and Wellness. Today I'm going to take you through a hip mobility series. I'll put some variations in there and show you some modifications. Also, we'll be moving the rest of our body a little bit too, but know that this is focused mainly on the hips. So we're going to start on all fours. And when you get into this position, because we're being mindful, we're going to make sure that we actively stabilize through the scapula. So you're snugging your shoulder blades up against your back. You're drawing your abdominals in to support your spine here. And we're being careful that we're not sinking into our lower backs. And then we're just going to be rocking back and forth at the hips at first. Now, we're trying to rock back and forth only in a range of motion that keeps the spine in neutral. So at some point you'll get far enough back that the tailbone starts to move and the spine starts to change. We don't want to go back to that point, so we're only rocking within our range of motion. For some of you, it's going to feel like you kind of have to stick your bottom out a little bit in order not to tuck your tailbone under. Now, if you have some sensitivity in your hip joint because you know you've got a pathology of some point there, then you want to stay out of the pain, right? It may be that you don't feel much doing this. That's fine. We're just lubricating the joint. Now we're going to go from here into little circles. So I'm going to shift my weight slightly forward and I'm going to circle as if I'm making a clock. So I'm going to circle to the right, passing through 1, 2, and 3, going back 4, 5, 6, over to the other side 7, 8, 9, and up to 10, 11, and 12. And then I'm going to reverse that circle. So 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, and then 2, 1, and 12. And we're going to keep going clockwise and counterclockwise. And then, of course, I am circling at my shoulder joint too, right? So while I'm up on hands and knees here, I am working a little upper extremity strength and weight bearing through my upper body. You could also be on your fists if this is bothering your wrists. You could also put your elbows on like a little low table, or if you have a cooler hanging around or a few books, you could stack them up and be on elbows so you don't feel it through your wrists. And when we're done with that, we're just going to sit back into a little round back position. So this is, I call this a shell stretch from Pilates. Or if it feels better, you could open your knees and lengthen out into more of a neutral position. And if your knees or hips can't tolerate this, you could put something underneath so that you're not as far back. So I could use, for example, I happen to have one here, a foam roller, and I could use my foam roller to support me, and then I'm not as at extreme of an angle, but I can still enjoy that lengthening of my spine and stretch through my chest. So we're going to come to seated, and ideally we're going to be crisscross with the legs. Now, if you can't do this position, if you're feeling that this is too congested for you and your knees are up, you could stack yourself up on some sort of a pillow to elevate you so that your knees can drop down a little bit easier. So that's an option for you. Or you could even do this on a chair. Now, I don't need a foam roller for this, but I'm going to use it, and I'm going to hinge forward. So I'm just trying to stay in neutral as I go forward, or even extension, and then I'm going to round at the bottom and roll back and I'm trying to stretch the outside of my hip. So side view of this is I'm lengthening forward, and then I'm scooping the abdominals and rolling up. So what's nice is I'm getting a little stretch on the outside of my hips, and I'm also getting to work through my spine a little bit. So lengthening forward, and then rounding at the bottom and coming up, and lengthening forward, and rounding at the bottom and coming up. And then we're going to change the crossing of the legs, so whatever leg was in front comes in the back, and we'll repeat it but slightly different. So I'm going to round it down first, and then I'm going to lengthen up. So nodding the chin, rounding down. Now if you do this video multiple times, you might want to change which leg you lead with, or you might just say like, look, I'm going to keep with the previous one because I want to be super balanced with what I'm doing on both sides. So make it your own. 2 more here. And don't worry if you're not going deep. The whole idea of this is that we're just going to do repeated movement and hopes that these repeated movements get us more mobility in the joint and the tissues around it. So put the foam roller aside. Like I said, I could have done that just with my hands on the floor, but it's a little bit more playful to have the foam roller. Now we're going to go into a Z-sit, and I just want to show you how you can modify this one too. So the Z-sit is sitting in a zigzag position, and it's possible with this internal rotation of the hip that it can feel a little uncomfortable for some people. So elevating yourself so that you have one side of your pelvis on and the other side off will allow that hip to drop down and get you a little bit more organized. This is my restricted hip, so if I'm down lower, it's harder for me to square off. I can do it, but if I'm feeling really pinchy in here, uncomfortable, it may be better for me to elevate. Now, what we're gonna do is we're gonna think about there being a clock on the floor. Your pubic bone is at 12 and your tailbone is at 6. And instead of rocking forward and backwards, we're going to go just to the side of the 12. So I'm shifting slightly forward and then slightly back. So I'm going on a diagonal. I'm going forward to the side of my pubic bone and then back to the left side of my pubic bone. What we're thinking about here is moving very subtly through the hip joint. Now, I feel like there are a couple ways you can think about this. One is that you're really almost trying to keep your pelvis flat on the floor. So you're just shifting back and forth smoothly. And you could also, because the hip is a ball and socket joint, you could sort of go up and over and up and down over it. And maybe one feels better to you, maybe both feel appropriate. And again, you don't want to go into pain. You could go and approach a level of stretch, but we don't want something that's going to provoke any symptoms. If you happen to be dealing with a hip issue or you feel this in your knee, then you'll want to prop yourself up. If you want to add upper body, we could rotate around, allowing the pelvis to shift and rotating back. And then I like to add a side bend up and over and around. So now rolling, you see I'm allowing my pelvis to rotate more and open and then up and down. And sweeping across and open and up. I don't know if you can hear me, but I have a coordinated breath with this. So exhale, inhale, exhale, inhale, and one more like that. And up and down. And then we're gonna change to the other side. So you come into that Z sit. Again, we started orienting to our clock, not 12 and 6, slightly shifting to the side and back, forward and back, forward and back, forward and back. Couple more, thinking more of this as flat, shifting forward and back between the, let's say, 11 and 5, or the 1 and 7, if you're orienting to a clock. And then we also do that one where we sort of allow a little bit more up and over movement. As I do, I feel my tailbone or my sits bone lifting off a little bit at the back, but I'm trying to roll my pelvis up and over my femur. So my pelvis is rolling over the ball here. Couple more there. And back, so it's a little bit bigger movement. And then we added rotation, open, and a side bend. And now you're getting to work through your whole body. Allow your pelvis to move as you rotate. And up and over. And rotate. And up and over. 2 more. And rotate. Up and over. And 1 more. And up and over. All right, nice. We're going to come into a half kneeling position now. So just from the front view, 1 foot forward, the other leg is back. When you get in this half kneeling position, you want to make sure that your hip is not popped up like this. So you want to square your pelvis off. I'm going to show you side view now. And if this is uncomfortable on your knee, you could put something under your knee. If you're having a hard time squaring your pelvis off, you could put something under your knee so that it's easier to level your pelvis. So you've got options there. So from here, we're tucking the tailbone. So I'm using my glutes to lengthen at the front of the hip. You may feel it through the quad. And then release. And tuck. Now this does not have to be a balance exercise. I actually have my hand on the wall so that I can focus on mobility. You can do balance stuff later. Tuck. And then release. Tuck. And release. And we can make this a little bit deeper. Shifting the weight forward and back. Little tuck, shifting the weight forward and back. And again, tuck and shifting forward and back. And 1 more tuck and shifting forward. And then we can rotate. I'm going to show you front view on this. So my arm can come up and across as I rotate, and I'm allowing my pelvis to rotate around my leg, and then reaching back. Now on this one, currently I'm stacking my pelvis directly above my leg. So I'm not leaning forward. I'm rotating my pelvis on top of a stable femur. So I'm working more on joint mobility here. Maybe a little bit of stability. And then if I wanted to, I could carry that into, again, a little rock forward, a little rock back. I'm tucking still a little bit, so I wind up my hip flexors and back. Using this multiplanar movement, because in real life we do move not just forward, back, side, side, and rotation, but we often do it all together at the same time. And 1 more there. Now, while you're here, you could go into deeper stretches if your body allows you, right? We could go into a nice lunge here and go deeper into a stretch. But I'm going to continue on to the other side, and we'll pick up with some other mobility exercises on another day that might go deeper into it. So we squared the hips off, right? We're stacked right on top. We started with just tucking the tailbone down to open the front of the hip, and then release. And tuck. And release. And tucking under. And release. And again, you're looking for the stretch at the front of the hip. You may feel it down into your quad as well. And then we added a little rock forward as we tuck and release. And tuck and rock. And release. And again, tuck and rock. And release. 2 more tuck and rock. 1 more. And then we added the rotation. I'm stacked up. I'm rotating my pelvis now over my femur. Inhale, rotating back. Exhaling, winding that tissue up. And then remember, we added a rocking to that to make it a little bit more extreme. You have to be careful as you rotate. You don't end up arching your back. So I am staying very connected with my form and with my abdominal connection as I go, so I don't end up exploiting a vulnerable area. And then 1 more there. So we stretch the front of the hip, we mobilized around the joint. Sometimes the quad gets very involved, but you do have one of your quadriceps that runs over your hip and your knee. And when that's restricted, it's also going to limit the range of motion at the front of the hip. So we're going to come down onto the floor to do a quad stretch. So first thing you want to do is lengthen your tailbone, zip up your pubic bone so I'm not arched in my back, and then I'm going to take my knee towards my touch. Now, if you're limited in range of motion here, we can use a yoga belt to help. You could hold on to your socks. You could use even just a regular belt to loop around, or a like a band. So when we're holding this, we could do something a little bit dynamic. I could press gently into my hand and then try to release it. And press gently and then release. And press. And now if your knee is bothering you, then you need to go less. 2 more there. 1 more there. So what I want you to think about is, you could get I can get my butt towards my heel towards my butt, but look what I did with my pelvis. I lifted it off the floor. So that doesn't really count. I need to try to keep my hip bones down on the floor. We're going to do the other side. I wanted to show you the stretch with the band. So just for the other side. So you're on your stomach. And so I'm using that yoga belt. This way I don't have to contort my body for the stretch. So I'm holding that stretch, tuck the tailbone under, and I can do the same thing, pressing and release. And press and release. And press All right, so we've stretched the quads, and then we're going to come onto our back so we can stretch the back of the legs. So using the belt still, or again, you could hold on or grab your sock. And you want to be in sort of neutral here with your lower back. And then it helps actually to have the band or your belt around the ball of the foot to get through the calf as well. And we can do the same thing here. You can obviously hold for the stretch, but I can actually push using my hamstring slightly and then release. So trying to contract the back of the leg a little bit and then releasing to see if I can pull it closer. And press and release. And one more press and release. And we're going to do that to the other side too. So, finding neutral. Now, of course, you know, we could be at different lengths here, so wherever you are is fine. We're trying to feel the stretch in the belly of the muscle. We don't necessarily want it, or we really don't want it actually around the insertion points. With turning the toes down, you might feel more in your calf too. And then again, you're pressing gently. And then see if when you release, you can go a little bit deeper. So press and release. Couple more, press and release. And one more there. And release. So I'm just going to put that aside. We're going to take a couple more moments to stretch the sides of the hips. So you're going to have your feet wide. If you're on a mat, your feet are wider than the mat, and then we're going to roll onto our side. If you can, you want that knee directly out from the pelvis. If this is uncomfortable on your knee, you might have to either straighten the leg or pull the knee slightly forward. And then what we're going to do is, this may be a big enough stretch for you down the outside of your leg or at the side of your hip here, but you can do little bounces right there. The bounces are more about getting some fascial mobility, so it doesn't have to be ballistic. We're just trying to get some hydration and play in between the tissues there. Easy breath. In this position, I have to think about tucking my tailbone a little bit so I'm not arched in my back. Maybe you do too. And then we're going to come out of that. We're going to roll to the other side. I'm going to spin around because I think it will be weird if I don't. And then we're going to do the bounces there. Again, checking in with your lower back. One side may have a lot more mobility than the other. This is why we're doing this, right? Because we're trying to give our, get balance in our bodies. Okay, and come out of it, and then come back to the first side. We're just going to add another element. So I've rolled over, and then we're just going to reach the arm overhead so we kind of take up the slack in our fascia, and do the same thing there just to see if that changes the sensation for you. Easy breathing, little bounces, or you could not bounce, right? This could feel extreme enough to you that you don't need to bounce. And then again, rolling to the other side. We're going to do that. And bouncing there. Okay, there's never a great way to wrap it up, but we're going to finish off with a seated stretch. So you're going to start seated as neutral as possible. You're going to take one leg over the other, and then we're going to hug that leg in and rotate. If you can, fold this leg in. Try to get your weight on top of both sits bones. Hug that leg in and rotate. So we're getting some spinal rotation, but we're also still continuing to stretch the outer hip. It would be easy just to do hip mobility stuff all day, or mobility generally for me. It feels so good. Breathing there. Okay, and then we're going to come out of that. You can linger there if you need to. The other foot comes over. Again, you could stay there and rotate. You could cross this one, get your weight on both hips, and then gently rotate there. You don't want to force your rotation. You want to let your breath help facilitate the rotation. So it's more about what can you let go of versus how can I make more happen. All right, guys, well, thank you so much for joining me for this. I hope that it felt good and it was helpful. There'll be more videos to come on mobility and stability and functional movement and different movement flows, all that should feel good to do. I'll talk to you soon. Bye.